I had some health issues of my own, actually. Was having pain that was misdiagnosed for several years, but tried acupuncture as an alternative and fell in love with it. Oriental medicine includes herbs and Tui Na massage, gua sha, cupping, acupuncture, diet, exercise, all kinds of things. I focus mostly on acupuncture as a practitioner personally. Insertion of needles is usually pretty insignificant. You may feel a pinch as the needles go in, but once needles are in, there's usually no sensation from them. When we stimulate muscles, we're looking for contraction and relaxation of the muscle. I always hope a patient feels better on their very first session. Lasting results from that first session may not be there, but through the course of a handful of sessions, typically I say 6 sessions, 2 sessions per week for 3 weeks to accomplish those goals. My name is Tom Betts. I'm a doctor of acupuncture and Oriental medicine. My passion is to restore function in an effort to reduce pain and increase performance in my patients.